Subscribe now for easy-to-understand health tips. Imagine waking up one day to find that the world around you feels a bit distant. Suddenly, familiar names just won't come to mind. Yesterday's conversation feels blurry. Small appointments seem to have vanished into thin air. These moments can feel frightening, but they're much more common than we think, more common than we realize. Today, we will understand what memory loss or dementia actually is, why it happens, and when it should be taken seriously. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP, UK, medicine specialist and expert in diabetes and hormones. This information has been collected from Mayo Clinic, Cleveland Clinic, NHS UK, and other trusted medical sources. Before we begin, make sure to subscribe to get more easy, science-based, doctor-reviewed health videos that will help you understand your body better every day. Dementia doesn't just mean forgetting things, it means being unable to remember information that you used to recall very easily. This can be temporary, or it can be permanent. It can happen suddenly, or it can gradually worsen over the years. This happens because many parts of our brain work together to create, store, and recall memories, and if any part doesn't function properly, problems can arise. Memory slipping or taking longer to recall something is not necessarily a sign of a memory loss disease. Taking a bit more time to remember things is a normal part of aging. Stress, lack of sleep, anxiety, or being overly busy can all temporarily weaken memory. But true dementia is different. In that case, even if you give it time or hints, the information does not come back. There are two main types of memory loss. Sudden memory loss, which is called amnesia, usually happens abruptly when an illness, injury, or some event disrupts the brain's function. Memory loss that gradually worsens over time can be an early sign of mild cognitive impairment or dementia. What are the early signs? Repeatedly asking the same question. Forgetting recent conversations, losing familiar objects. Forgetting appointments or bills. If this is accompanied by difficulty finding words, trouble recognizing familiar faces, struggling with daily tasks, or problems maintaining focus, then it becomes even more significant. Memory loss can occur for many reasons. Sudden memory loss may be caused by head injury, stroke, aneurysm, brain surgery, severe infection, carbon monoxide poisoning, intoxication, the effects of medication, alcohol-related blackouts, or psychological trauma. The main causes of gradually increasing memory loss are Alzheimer's disease, Lewy body dementia, Huntington's disease, vascular dementia, brain tumors, MS, sleep disorders, depression, and uncontrolled chronic illnesses. Is there a treatment for dementia? At this moment, there is no direct cure for dementia. The main goal of treatment is to identify the underlying cause and give the brain a chance to recover. If dementia occurs suddenly, immediate emergency treatment is required. For gradually progressing dementia, the sooner it is detected, the better the chances for treatment. What can be done at home, using calendars, notebooks, smartphone apps, and alarms, does not weaken memory. In fact, it strengthens it. Staying socially active keeps the brain engaged. Physical exercise increases blood circulation and keeps the brain alert. Learning something new, solving puzzles, hobbies, and creative activities, all of these help strengthen the brain's connections. Ignoring memory loss can be dangerous. Memory damage caused by stroke, infection, or head injury can become permanent if left untreated. Memory loss that progresses slowly can also worsen rapidly. If not detected early, memory loss cannot always be prevented. However, some causes, especially amnesia, are preventable. Wearing a helmet or seatbelt, keeping blood pressure, diabetes, and epilepsy under control, seeking treatment for depression or anxiety, and maintaining a healthy weight. Avoiding drugs or non-medical substances, limiting alcohol consumption, and seeking prompt medical treatment if an infection occurs. Taking the medication prescribed by the doctor properly. All of these help protect the brain. When should you see a doctor? Sudden memory loss is always an emergency. If you notice gradual memory loss, you should see a doctor without delay, even if the symptoms are very mild. If treatment is started early, future planning, independence, and treatment success all improve. Another important question: do emotions affect memory? Yes, depression, anxiety, or suppressing emotions for a long time can interfere with the brain's information processing and memory retention. That's why mental health is extremely important for protecting memory. The truth is, dementia can seem terrifying for the person affected and for their family, for everyone. But having calm and empathetic conversations about the issue in advance can make a big difference. It guides treatment and ensures safety. And it helps the family to understand and support each other. This script was written and reviewed by Dr. Shreyashi Chatterjee, MRCP UK, medicine specialist, diabetes and hormone specialist. The information has been collected from Mayo Clinic, Cleveland Clinic, and NHS UK. If you liked the video, don't forget to subscribe and share, because awareness is the first step to recovery.